So we were two rapporteurs. My name is Perez Akelo. I'm based here in Kisumu. And my colleague is?
I'm Faith Behero. I'm also based here in Kisumu.
Yeah. So we want to share with us the presentations of yesterday, but just giving highlights. So Honorable Tichilo, Dr. Otichilo, who was our keynote speaker, that nurses play a big role in achieving UHC. You remember he said the nurses are the foundation of the health system. He also reminded us that of what strategies he has given to make Vihiga County work. And I think that was like a landmark for us. He said we are sharing. They have put structures in place. And what are these? Some of these structures. They have put structures in place, like improving facilities. They have put their policies to support the implementation of the things that they are doing, and they have also strengthened lower level facilities, that is the community. So in the approach of UHC, they have looked at the health infrastructure, that is according to Vihiga. They have looked at the human workforce and the community. And the other thing, he said we have challenged, they have UHC as a whole, and especially in the 4 counties where the pilot has been done, the challenges are the same across the board. 1, there's a challenge with human resource, and there is an upsurge with service delivery. 2, there's a challenge with implementation of UHC. Why? The logistics or the supplies, they are not adequate. Remember, he told us that supplies are supposed to come from KEMSA. The upside patients are coming because they are free services, but they can't get the quality of services that they need. So in a nutshell, that is what we got from the keynote address. And then we had Madam Honorable First Lady of Kisumu, Dorothy Nyong'o. Dorothy Nyong'o reminded us that nurses must be committed to the service they are delivering, because nursing is a calling as much as it's a profession. You can't come in and just give services when you don't have a call. Remember, it's not the service. It should come from within. And she told us she's part of us because she's a child of a nurse. And she said the role of a nurse is quite critical. This kept coming time and again. Why is it critical? When the nurse is not there, people are left desperate and hopeless, and lives are lost. And we had Honorable First Lady from Homa Bay, Honorable Mrs. Awiti, and Mrs. Awiti is also a nurse. She's a nurse, and she applauded the regional cooperation that was displayed, because this is a regional meeting. And what she emphasized on was collaboration and strengthening ECSACON to encourage experience sharing and partnership and collaboration. When we come together, we have experience sharing, and besides that, when we share our experiences, we have a voice even to talk about the kind of funding that is needed to ensure services are delivered appropriately. So coming together will trigger the aspect of funding the services. We had our CNR, Mr. Omia. Mr. Omia reminded us that this was the first ECSACON county chapter meeting in Kenya, and it is ECSACON week across the board. We were reminded of when ECSACON was first born 29 years ago in Malawi. And the members, the senior members in the sitting were appreciated. We had them here, Dr. Rosemary Okova, Dr. Patricia, Mr. Samuel Kiragori, We have Madam Isabella, who was not there then, but she came as we were doing our things. We all know Madam Isabella. And then what was it that he came up with so strongly? We think we are focusing on the future of nursing and UHC, you and me. We are focusing on the future of nursing and UHC, and we are reminded of the 4 faculties of ECSACON. And the 4 faculties are clinical, research, education, and leadership. We had Dr. Okoro from UNFPA, who shared with us on UHC as an achievable. UHC is unachievable without the role of the nurse. And you are told, he said he's a friend of the nurses, that we need to invest in nursing to promote the human resource for health care, so that we come to 80% of healthcare is by nurses. The other said 60, but he said it is 80%. And he came in to remind us, to blow a trumpet, that there is, or to make an announcement that there is an upcoming ICPD conference called ICPD 25, coming up as a follow-up, and Kenya, together with Denmark, are the key players on it. And nurses and also ECSACON has to make a commitment in presenting ICPD conference by bringing something on the table that will change the future of nursing and midwifery. And then we had KPNA from Mr. Nyongesa, who called upon the need to have nurses in decision making at all levels, need to speak, not keeping quiet. And we had Mr. Kobengo. With that, I want to have my colleague continue from there.
We had Dr. Soti, who was standing for the Director of Health at the Ministry of Director General of Health at the Ministry of Health. And what came out is the need to increase the internship planning sites. That is something that the ministry is looking at, because of the realization that with that you are improving access to service provision at those levels. And he also talked about the resolution at the World Health Assembly, making the year 2020 as the year of the nurse. So I think as we sit here, we really need to strategize and see what are these that we are going to do for that year in line with the Nursing Now campaign. What are we, as for example ECSACON, willing to profile as we talk about the year of the nurse? He also appreciated the role of partnerships, those that were present, and he specifically talked about UNFPA, InterHealth in supporting the government to achieve its goals. We heard a lot from Dr. Rai, and he was very critical in terms of emphasizing the need to have professionals at the community level. He talked about wellness instead of waiting to have patients in our hospitals of preventable issues that could have been held at the community level. And he talked of how can we change the strategy. We have sung the same song. It's a high time for us to change the strategy. How professionals at the community level to have these issues addressed as early as possible. Then from the key speakers, sorry we are not going to acknowledge everyone in terms of their names, but we just picked up specific issues that arose from their presentations. There was need to have screening of mothers at all levels during pregnancy. One of the presenters noted that some of the women who came to hospital were not even aware that they were actually pregnant. So there was that need to look into that. Then there was a good discussion about policy adherence and whether those adherence to policy actually translates to health outcomes. Or are we developing policies that have no impact on the health outcomes, that is something that maybe somebody can also look at. A need for nurses to get involved at policy development, that has been talked throughout by all the presenters. Knowledge on use of FP and contraception among young people. There was issues of misuse of the e-pill at the health campus. Now, if our thoughts are, if e-pill is being misused in an institution that has training of healthcare providers, what about other institutions? We need to go back and think about use of contraception among the young people and whether the knowledge they have can actually prevent them from getting pregnant when they don't want to. There was also, from that same presentation, there was also concerns on abortion among college students that are not conducted in health institutions. What is the way forward? And there was also looking at the approach of incentives to encourage antenatal visits and hospital deliveries. Is this really sustainable? So that is what we captured. It's quite summarized. I know there was a lot, but just summarized for the purpose of this presentation. Thank you.